We're back with a concerning new trend regarding COVID cases across the U.S. New CDC data shows up to 39 states are seeing an uptick in infections, and with summer travel on track to break records, already this weekend we've broken some, health experts are urging people to take extra safety measures to keep themselves and others healthy. NBC News medical contributor Dr. Kavita Patel is with us this morning to explain what is going on here and how worried we should be and what we can do. Dr. Patel, good morning. So we're seeing increases in both COVID deaths as well as emergency room visits. In addition to that, the CDC says hospitalizations are up 25%. That's from May 26th up to June 1st. Why are we seeing a spike now after the traditional cold and flu season?
Yeah, great question. And who thought we'd be in the summer talking about COVID again, but here we are. So a couple of things are driving this. First of all, we had some limited immunity during this past season. We had kind of lower levels of COVID. That means people weren't getting as infected and developing that immunity, and that's why you're seeing an uptick now. Second, it is so hot that people are crowding indoors to stay out of the heat, and that just gives you an environment where you can give it to each other. And the third is a subvariant. It's LB1, which is actually a little bit more infectious. We hear this a lot, right, with the new variants. Each one gets a little bit more infectious, not necessarily more severe, but easier to give and get. And that's what's driving this spike.
Yeah, so tell us, this likely to become the dominant strain, right? This LB1.
Yes.
Are the symptoms different variant by variant? I mean, I remember when this was happening. I mean, by the way, does anybody else here new strain and kind of have PTSD from this? But you wouldn't necessarily really feel different. Maybe it was a little bit more severe, but it was more about the way it's able to move between people who may have immunity to some other strain. What about now? What do we know now?
Yeah, that's exactly right. So yes, in terms of symptoms, it's still pretty similar. And here's the only thing I would say is that if you think, hey, I'm a little sick, but it doesn't seem like COVID, you probably should just check anyway, because many times if it's a GI bug, we're seeing GI bugs going around. We're seeing some people come in and the first symptom is like an eye infection, a viral kind of conjunctivitis, and they're like, that can't be COVID. But it can be. So it mimics cold and kind of flu symptoms, but it can also present in slightly unusual ways, but nothing that would make you say, oh, wow, this definitely must be COVID. So I just want to kind of prompt people, when in doubt, get it checked out.
So what should people do to keep themselves, but also really importantly, others safe? Maybe you're sick of wearing that mask. Maybe you forgot about it. Maybe you don't own them anymore. But what do you need to keep in mind, not just for yourself, for other people?
Yeah, so we're going to show on the screen, we're going to show some tips, and I think that each one of them are worth kind of ticking through. But let me underscore something here. A lot of us have gotten rid of our tests at home. You know, we used to have them all. You could get them in pretty easily. You still can, but we need to get those tests back again so we can check so that when you're sick that you can actually just stay away. CDC does recommend that if you do test positive that you should put a mask on and limit movement with kind of immunocompromised people. But those are the basics.
Specifically, what advice would you give to those who are more vulnerable to COVID-19, like older Americans, things like that, especially since, like you mentioned, it's kind of hard to imagine we're talking about this when it's summertime and it feels warm out and we're not getting sick around this time normally. Right. So keeping up to date on vaccines, we expect a new fall vaccine, but that's several months away. So you can still go in and get one shot, and that can protect you. It doesn't protect you right away, but it starts the immunity after a couple of weeks. And then, of course, I would say make sure that you do something. If you are with immunocompromised people, besides the masking and washing your hands, I would absolutely make sure the air circulation. Don't forget, good air can help you not spread this. Dr. Kavita Patel, thank you for being here. Really good tips, good information. We appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.